7 warning signs that may indicate heart problems. Hello. How is your heart? Is everything okay, or is there something worrying you? Today, we will address the 7 signs that your body may present, indicating that your heart may not be in perfect condition. We know that cardiovascular diseases are the leading cause of death in Brazil and worldwide. Here in Brazil, approximately 400,000 people die annually due to heart problems, according to the Brazilian Society of Cardiology. So, stay tuned. I will divide this content into 3 parts. The first will address the 7 visible signs that may indicate heart problems. The second part will address the 7 classic symptoms that you may feel when your heart is not well. And finally, I will give valuable tips to prevent heart problems in the future. It will be a very complete content, so watch it until the end and I am sure that you will learn a lot. But first, like the content, because the more people like it, the more YouTube will distribute it to those who do not have access to doctors or hospitals. Share this with your friends and family. Many lives can be saved with your help. So, share it, and tell me, do you have or think you have a heart problem? What part of Brazil or the world are you from? Write in the comments. 7 signs and symptoms of heart problems. Let's go. What are the 7 signs that you should watch out for that may indicate heart problems? 7th sign, Frank's sign. Starting today, you will start to observe people's ears more closely. There is a sign in the ears that may indicate blockage in the arteries of the heart or carotid arteries. In the 70s, Dr. Sanders Frank noticed that many patients with chest pain had a diagonal crease in the ear, known as Frank's sign. The connection between the heart and the ear can be explained by the same factors that damage the arteries, also causing this crease in the ear. 6th sign, hair loss on the legs. Loss of hair on the legs, especially on the shins and thighs, can be a sign of peripheral arterial disease, indicating blockage in the arteries of the legs. Atherosclerosis is a diffuse disease, so blockage in the legs can indicate problems in other arteries, including the coronary arteries. 5th sign, xanthelasma. Xanthelasma are yellow plaques on the eyelids, usually on the upper eyelid. About 50% of patients with xanthelasma have dyslipidemia, that is, high cholesterol or triglycerides. Although only 1% of people with high cholesterol have xanthelasmas, the presence of these plaques increases the risk of heart disease. 4th sign, arcus senilis. Arcus senilis is a deposit of cholesterol on the edge of the cornea, common in older people. In younger people, it can indicate severe dyslipidemia and increase the risk of heart disease. 3rd sign, cyanosis. Cyanosis is a bluish or purplish discoloration of the skin, which can indicate heart or lung problems. If your skin is cyanotic when you are warm, it can be a sign that the area is not receiving enough oxygenated blood. 2nd sign, ulcers. Wounds that do not heal on the legs or feet can indicate poor circulation due to blockages in the arteries. These ulcers are usually painful, but the pain may not be felt if the nerves are affected. 1st sign, swelling in the legs. Swelling in the legs, ankles and feet can be caused by a weak or enlarged heart, which accumulates fluid in the body. This swelling is most noticeable at the end of the day and can be reduced by elevating the legs. 7 symptoms of heart problems. Now, Let's look at the 7 symptoms that you may experience, indicating heart problems. First symptom, shortness of breath. Shortness of breath, especially when exerting yourself, can be a sign of heart problems. It is a tiredness that is disproportionate to the effort. Second symptom, persistent cough. A persistent cough with white or pink phlegm may indicate fluid in the lungs, a sign of heart problems. Third symptom, shortness of breath when lying down. Shortness of breath when lying down may lead the person to use more pillows or sleep sitting up. It may also cause paroxysmal nocturnal dyspnea, waking up suffocated during the night. Fourth symptom, generalized weakness. A feeling of constant tiredness and difficulty in daily activities may indicate that the heart is not pumping enough blood to the muscles and tissues. Fifth symptom, nocturia. Waking up several times at night to urinate may be a sign that the heart is not pumping properly, accumulating fluid that needs to be eliminated. Sixth symptom, intermittent claudication. Pain in the calf when walking, which improves when stopping, may indicate that blood is not reaching the area properly. Symptom 7, chest pain. Chest pain can be a sign of a heart problem. It can be pain or discomfort that lasts for more than a few minutes, radiating to the left arm, neck, back, jaw, or stomach. How to prevent heart problems. Exercise. Physical activity is essential for circulation and mental well-being. Quit smoking. Smoking is one of the worst things for your health, causing impotence and increasing the risk of heart attack and stroke. Lose weight. Being overweight increases blood pressure and worsens blood sugar levels. Eat well. Eat fruits, vegetables, fiber, whole grains, and olive oil. Family history. If there is a family history of heart problems, get more in-depth tests. Take care of cholesterol and triglycerides. Eat more oats. Cut out trans and saturated fats, and exercise. Control glucose. If you are diabetic, control your glucose levels. Control blood pressure. Keep your blood pressure below 120/80. If you think you have heart problems, see a doctor immediately. Did you like the content? Share it so that more people have this knowledge. And what will be the next content you will watch? Leave your recommendations in the comments. Remember to subscribe and see you in the next content. Thank you very much.